Well, good morning. And to reinforce a few of the things the governor mentioned, yesterday we acted very quickly as a state in pausing the Johnson & Johnson vaccine because the Food and Drug Administration with the Centers for Disease Control made that recommendation. And as the governor said, that this recommendation was based on 6 total cases out of 6.8 million vaccines of an extremely rare occurrence called central nervous system sinus thrombosis that is again a 1 in a million event in people in the United States. The reason why the FDA and CDC, though, paused the Johnson & Johnson vaccine was because in this particular set of 6 incidences in women between 18 and 48 years old that occurred 6 to 13 days after the Johnson & Johnson vaccine, or that this was also associated with a reduction in the blood clotting factors, the platelets, which would be an unusual occurrence. And it resembles an immune-based problem that can happen related to the use of a particular blood thinning agent called heparin. So one of the concerns by the FDA and the CDC were in this circumstance of this unusual blood clotting problem, which clots the veins, the draining part of the blood from the brain that can back up some of the blood and cause more pressure, causing people to have headaches or blurry vision or feel dizzy or not feel right, is that the lowering of the platelets implies that there may be an immune process going on. And because of that, then the usual treatment, which would be the blood thinner heparin, would not be indicated for the treatment of this particular occurrence with low blood platelets and this unusual blood clotting problem. And therefore the treatment would be different. So my understanding is that the FDA and the CDC and a CDC advisory committee is going to look at these cases, make recommendations, give us guidance, which will allow us not only to be able to, make sure we're treating the right people with the Johnson & Johnson vaccine, but also that we are treating any rare effect that we might see in a way that's safe and effective. And I think that, as the governor said, the real take-home message here is that the vaccines are all very safe. Particularly, we've seen the Pfizer and Moderna vaccines really not have any associated problem or finding like we are seeing in this very few number of cases related perhaps to people taking the Johnson & Johnson vaccine, but also that everybody, federal government, state, are acting out of an abundance of caution and being careful to make sure that everything is absolutely safe. And again, these vaccines are all very effective, and the Johnson & Johnson vaccine is also very safe, given that even if this is an occurrence with the vaccine, that's 1 in a million. But suffice it to say that we know that these vaccines are really responsible primarily for the 90% reduction in deaths we've seen over the first 13 weeks of 2021, for the reduction in hospitalizations. And we know that the ultimate ending to our story here in West Virginia related to COVID-19 and in our country is going to be directly related to West Virginians and Americans who are going to choose to be vaccinated to protect themselves, to protect each other, because as we get toward the number of people that will get us into that range of herd immunity, this 75 to 80% or so of people who will become vaccinated and immune, then we know that we will be able to stop the spread of COVID-19 and the variants. And we're seeing more variants. We're up to 243 of the United Kingdom variants in West Virginia, which is a number that's growing. And that we know that the real key for us is to have all West Virginians who have not yet been vaccinated, who are eligible to be vaccinated, to please choose to do so. And in doing that, we are all running to the fire. We are all taking care of each other. And we are again shining the light brightly from the state of West Virginia for all others to follow. So it is really a critical time, and it is up to us. And while we're pausing immediately the J&J vaccine, we have Moderna and Pfizer and plenty of sufficient quantities to vaccinate everybody. And we anticipate that the J&J vaccine will restart soon with perhaps additional guidance from the FDA and CDC. So thank you very much.